Yes, Mark's definitely aware. That's why they added another session.
Thank you guys all for coming. Isn't democracy grand? You bet. We want to thank everybody. This was on a first-come, first-served basis. I don't know what your views are on this. I'll hear this, but I'll say that everyone is welcome, whether you're a carnivore, a vegetarian, or agnostic here. And what I'd like to do to focus the attention is briefly go through two quick presentations to focus our debate. First, if I could go to the first slide here. I am very concerned that we make sure that we preserve the quality of care in the United States. And you see it here across prostate, bladder, breast, and uterine cancer. And what is surprising is in the United States, the survival rates are higher than in Europe. When we look at the overall uninsured, when you see the 47.5 million people, if you back out non-citizens, that's a question that we have to deal with. Should we provide taxpayer health care to people who are illegally present in the United States? Should we? So then, I'm going to go quickly through this one. Remembering that we already have about 12 million eligible for public programs, about 9.1 million who are only temporarily uninsured, and about 7.3 million who have over $84,000 in income. Remembering the average income in the United States is $56,000. That would mean that the number of lower income American citizens who have lacked health insurance for longer than 12 months is 7.8 million. The difficulty is that number is not big enough to justify some of the proposals that are being considered in Washington today.
I'm Callahan. I'm an American citizen, and I live here in Arlington Heights. Just to preface my question, because I do have a specific question, before I came to Illinois, I lived in Canada in the province of Quebec for 18 years. I honestly don't understand why President Obama has been apologizing for comments made about the Canadian system, because it's all true. That's a joke, you can laugh. Thank you. In H.R. 3200, one of the things that concerns me is the clause that would sunset ERISA after 5 years at the most and replace it with bureaucracy panels that would then say whether or not a company's healthcare system was acceptable. And actually these panels could keep people from signing up for the company's healthcare system if they didn't approve. In any legislation that you support, could you tell us that you would not allow for such a bureaucracy to interfere with our healthcare?
Absolutely, and you bet. We are all learning terms very important in this healthcare debate, and one of the terms we need to learn is ERISA. ERISA is the fundamental law which underlies employer-provided health care in the United States, covering roughly 170 million Americans. You know the key phrase in healthcare, do no harm. The one thing I want to make sure this legislation does when we go forward is does not dump any Americans from the coverage that they already have. And I'm very worried that even under the CBO score of H.R. 3200, the Congressional Budget Office score, it says that 15 million Americans at a minimum will lose their coverage, and I think that's the wrong way to go.
I just would like you to clarify that everybody who's a non-citizen is not illegal. But leaving that aside, I'm interested to know in your proposed bill, you talked about not letting the government get between patients and doctors, which I think is laudable. Do you have that same provision for not letting insurance companies get between patients and doctors?
We don't. What we want to do is make sure you have more and more options for insurance coverage. So right now, under our law, you are only allowed to get coverage from an Illinois insurance company. I think you should be allowed to buy from any state in the union. I'm also worried that the government does not have a stellar record in customer service.
I am my brother's keeper.
The reason I'm here today is to protest the government takeover of the healthcare system. We support the people and individual rights, and the vote in the House is coming up. We wanted to register our opinion. I'm here because I'm a small business owner,
live in Arlington Heights. My office is in Northbrook. And I've seen the cost of my health insurance that I provide for my employees has increased almost double in the last 5 years. 25% last year. This year I got an increase of 35%. I would love to get out of the healthcare business. That's not what my company is. You know, I was in Canada last week, and frankly, they think we're crazy down here. They don't understand why this is even an argument, why this is even a discussion. They say, yes, their healthcare is not perfect, but they would take what they have in Canada over what we have here any day.
Socialized medicine, and we think that we can fix the medical problem in America without destroying the whole system. Let's take care of the people that don't have insurance and keep the good insurance for the people that do have it now.
And let's protect life.
And we should not have to pay taxes for abortions.
And I'm a constituent of Mark Kirk's. Went to his office, asked for tickets, and I just found out that he gave them all to Republicans. I think that's very unfair. And so I'd like to make that note. And then I made this sign because I am very concerned that he will be our senator when he doesn't even care about his constituents. And really all he cares about is the almighty dollar. And basically they'll say, oh, well, what politician doesn't? But the point is that he's taking $1.5 million in lobby money from the healthcare industry, which is very true across the board with most Republicans. And even some Democrats, but you know, they're basically in the pocket of these insurance companies.
To let people know that we've got too much government involvement in the United States right now. We need to start backing off from this. It's getting scary because the government already is operating in the auto industry, in the financial system, and now they want to take over healthcare. We've already seen examples in other countries where this hasn't worked. We need to be smart enough to see that it's not going to work here either. And we need to put a stop to it before it even gets started.